Barack Obama is they expanded Medicaid to young, healthy adults. And so what the House has done, which I've been advocating for a long time, is if you're a young, healthy adult, you should be working and you shouldn't be getting Medicaid and sitting at home just getting a government check.
Now, I'm a Medicaid provider, so let's say we have a patient. Let's call her Mary. And Mary lives in a rural part of the country, and she works at her local grocery store as a checkout clerk. It's a minimum wage job. It offers no benefits, but she gets her health care through Medicaid. Now, times are hard, and her grocery store got hit particularly hard by tariffs and supply chain issues, so they have to lay Mary off. Now, Mary is scrambling to find a job so that she can stay eligible for Medicaid. But unfortunately, a lot of people in her small town got hit by these layoffs, and there really isn't much work to be had. And the nearest town with work is about a 35-minute drive away, but unfortunately, Mary doesn't have a car, and the public transportation system in her town is particularly dismal. So she keeps trying to find work, but unfortunately during this time she loses access to Medicaid, which means she loses access to her primary care doctor, her specialist, and the ability to get medications. And without those things, Mary's health starts to deteriorate, and she's in and out of her local emergency room with flare-ups of her diseases. And now she's racking up tons of medical debt. As Mary's health continues to decline, she realizes that she can't really stand for prolonged periods of time because of her rheumatoid arthritis, and she realizes that being a checkout clerk is no longer going to work, so she looks for other jobs, more sedentary jobs like a receptionist, but unfortunately a lot of those jobs require prior experience, which Mary doesn't have, so she doesn't get hired for those. She tries to apply for disability and then volunteer and do some community service so she can get access to Medicaid and her health care again. But unfortunately, the process to do this is very bureaucratic. There's tons of red tape. It's confusing, and a lot of it requires access to either a smartphone or the internet, both of which Mary lost access to because when her services got cut off, she couldn't pay the bills. She had to choose between her utilities and food, and Mary chose food. All of this is extraordinarily stressful for Mary, and she's still trying to find work, but she's getting sicker and sicker. And one morning she wakes up and she's really nauseous. She's vomiting. She's got a headache. She's dizzy. She's got chest pain. She's short of breath. She's a little confused. So she calls 911, and the ambulance comes to pick her up to take her to the emergency room. Unfortunately, her local emergency room has closed because it was primarily getting its funding through Medicaid, and with all these Medicaid cuts, they had to shut their doors. So the ambulance is forced to take Mary to an even further emergency room outside of town. But unfortunately, by the time she gets there, she has slipped into a coma. When she gets there, they test her. They find out she has diabetic ketoacidosis from missing her insulin, not by choice. She couldn't afford it. And she winds up in the ICU for a few days, and unfortunately, Mary dies. So let's pause there and have this discussion. So do you guys think that Mary was a freeloader? Do you think that she was just someone who was sitting at home getting a government check, milking the system? Or was she a victim of that system? Was she stuck in this vicious, perpetual feedback loop from which she couldn't escape? Were there many systemic and structural issues that were impacting Mary's ability to get care, Mary's ability to get work? Don't let Maga Republicans gaslight you into thinking that these are just work requirements. They're not Medicaid cuts. They are most certainly Medicaid cuts. We have data to support this. They did this in Arkansas, and when that happened in Arkansas, what happened was 18,000 people lost access to their health care, and it had no impact in employment. What this is going to do is it's going to make millions of people lose their health care. This will make the chronic disease epidemic worse, not better. People are going to get sicker. People are going to die. Rural healthcare systems are going to collapse. That is going to further exacerbate the already existing healthcare disparities, which contribute a lot to our chronic disease epidemic in this country. It's not good. As a physician who accepts Medicaid patients, I'm telling you right now, this is not good. But what can you expect from the pro-life, Make America Healthy Again party? Am I right?
Big beautiful bill Medicaid cuts. I'm for it because I'm an able-bodied American citizen right now. I'm headed to work. I work at least 40 hours a week. People need to stop just getting free benefits. If you can go to work, you need to go to work because we're tired of paying for everybody. So Medicaid cuts, we're here for it.
Here's my mother-in-law. She worked 40 hours a week too at the same company for 32 years, and she was union, and then she got brain tumors and she lost her health insurance because if you're not working, you're gonna lose your health insurance, and then Medicaid and Medicare kick in. Every single person is one tragedy away from having to be on Medicaid and Medicare. You're one brain tumor, one car accident, and for you specifically, looking at you, I can tell you're one heart attack away from needing Medicaid and Medicare. Now, I know that you think everybody that's on them is lazy illegals, but guess what? One day, you're gonna need it and you're not gonna have it. And it's not you that's paying everything. It's people like me, the younger generation, that are paying for that for you, for her. Now, thank God that she has successful children that can subsidize her way of life, because Medicare and Medicaid, it don't cover it all. You're going to be in poverty forever, and you're going to lose your house. You're going to lose your home. You're going to lose everything that you ever worked for, and you're going to have to move in with your kids. So I hope that you have fucking rich kids, because you just made that little tiny entitlement that you're going to need fucking smaller. I would like people like you to think of the future. You're gonna need it. For you, it's probably gonna be a couple years, all right? Because I could tell you've probably been eating butter and fried chicken for the last 20 years.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
We're in California's District 22, a rural community in the state's Central Valley. This district voted for Trump for the first time in 2024, but now his policies threaten one of the benefits people here rely on the most. Do you know anyone personally who voted for President Trump but depends on benefits like Medicaid?
Oh yeah, I know a lot of people.
One resident who would be impacted by Medicaid cuts is 64-year-old Irma Arredondo, who voted for Trump in 2024. Irma has several chronic health issues, including type 1 diabetes. She's also a full-time caregiver for her daughter, who has cerebral palsy, and her sister, who has Turner syndrome.
The medicine that my daughter takes for seizures, I won't be able to afford it. So we feel hopeless if those cuts come, you know. What we're going to do.
Irma was a farm worker for more than a decade. She believes that some of her and her children's health issues can be linked to the pesticides she was exposed to while working in the fields.
Look at me right now. Look at me, how many sicknesses that I have. We got all in the fields. Where else? I feel like these stubby nuts in the back, you know. But why? Why when we put food on their tables? Trump promised a lot of things. I thought it will be more family values and those programs that we really need here.
One of those promises was to protect Medicaid, which 67% of people in this district rely on. It's the largest percentage of any district in the entire country.
Can you guarantee that Medicare and Medicaid will not be touched?
Yeah, I mean, I have said it so many times, we're not going to touch it.
The yeas are 218, the nays are 214. The motion is adopted.
This bill represents the largest cut to Medicaid in American history. It will devastate vulnerable populations.
The largest tax break go to the wealthiest individuals. Are those your values?
No, that's not right.
Let me tell y'all one more thing about Maga. Okay, they're so confused. They don't understand what cuts to Medicaid will do. What happens is you have some country bumpkin talking about, yeah, the cuts to Medicaid aren't going to affect me or my family, but it will. It will eventually affect all of us. They fail to realize, you know, they say, I pay for my own insurance. And I'm referring to one particular lady, okay, because I watched her yesterday and she was like, and my daughter has insurance through the Obamacare. And so we pay for our insurance. And, you know, people say, they literally say that they're fixing the system for the people who need it the most. Whew, baby, when you make all these cuts to Medicaid, they fail to realize that Medicaid, you know, pays for a lot of things that they just don't know about. It's not for people who need to go to work and pull their bootstraps up. It's for people like expecting mothers. It's for people who are disabled, who can't possibly go to work and pull themselves up by their bootstraps. It's for elderly people in nursing homes, and it provides funding across the United States for hospitals. And of course, there's the big one. Obamacare, also known as the Affordable Care Act, will be impacted by cuts to Medicaid, because Medicaid is what helps fund the Affordable Health Care Act. I mean, it's ludicrous to say that insurance costs will not rise for anybody even on or in the Obamacare program or people who pay private insurance. So, MAGA doesn't understand that when they cut Medicaid, that rural hospitals will lose out, nursing homes will lose out, elderly people will lose, disabled people will lose. These are not working class people who need they think undocumented people are getting them, but you can't get Medicaid without a social security number. So that is false. It is false. And that's what they have been fed. They're being fed that that these cuts aren't going to affect them or me or you or anybody else's community. And it's really sad that they can't figure this out. We all know that it's just infuriating to deal with MAGA brains because they can't see past their nose to spite their face.
Who would have thought doctors would lose their jobs? But doctors are being laid off as well as nurses. And I've been doing the research, and this is the conclusion that I've come to. The Medicare fees that were being charged to Medicare by hospitals and or clinics were so inflated and so high and had so much profit built in that now that they've been reduced and now they're at the levels where they're supposed to be, the people who wrote the budgets didn't account for this. Therefore, it's going to look like they're losing money and they're not profitable. So like every other corporation out there, when you're chasing a number, if you're publicly traded, the easiest way to get there is to cut staff. And you'll hear these doctors say, I had lines, there was 6 months worth of appointments set up. It doesn't matter. If the hospital doesn't see the profit, the people that get cut first are those that work on salary. So they're going to have to take some time to adjust back down to where they were actually supposed to be, what they're supposed to be billing Medicare instead of the inflated numbers that were being allowed. And that is exactly why we see so many doctors and nurses being laid off, because they didn't account for losing as much profit as they did when they flipped the switch and dropped Medicare cost down to where it's supposed to be.
Donald Trump showed up to a press conference in rough shape. He looked unkempt and unwell. Now, this was yesterday when Donald Trump got up and for whatever reason decided to wander over to the White House gift shop. And there he rambled on a variety of topics before wandering back to the White House for a press conference with FIFA. And there again, he could not put together a coherent thought. And worse, he looked like this. Check this out. That is how the President of the United States looked on live television. That is just awful. He's not wearing a tie. He doesn't look put together well. Worse than that, the concealer on his hand is getting thicker and more noticeable. Now, if you think back to his last checkup, we were told that Donald Trump was in perfect health, that he had perfect blood pressure. He had the resting heart rate of a 20-year-old athlete. He had perfect cholesterol. Now we know he has chronic venous insufficiency. We know about the thing going on with his hand, and every day things start to look worse, but we're told to just ignore it. I have a feeling something's not right.
They say we can't afford health care for everybody, but we pay for theirs, and theirs is top tier. Mike Flood, the representative from Nebraska, he told Nebraskans in a town hall that America just can't afford free health care. He says it ain't no money for it. Question, then how do we pay his salary? How do we cover his health care? You know, that Cadillac, top shelf, never having to wait in line health care that members of Congress get? How do we fund his pension and his perks? Because y'all know he gets government covered everything. So how do we cover that? I'm going to break this down. America has the money. America has the money for health care, for schools, for job training, for affordable housing, safe neighborhoods, clean water. They have the money. What America doesn't have is the will to tax rich people. See, Congress is a tax haven machine for the rich. They design loopholes for their rich friends. And I know you're asking why. Well, because Congress is rich too. They're not struggling to pay rent. They don't even have to decide between insulin and grocery. They're not worried about an $800 ER bill or a $400 surprise at a regular routine checkup. They don't live in your world, baby. Congress creates policy that ultimately benefits them. Insider trading, corporate kickbacks, and tax shelters built like luxury bunkers. So understand, when it comes to you, suddenly you're the problem. You don't work hard enough. You just want handouts. I'm going to tell you something. You already work your ass off. You are the engine of this country. You work double shifts, juggle jobs, and stretch every damn dollar just to survive. Meanwhile, they sit on Capitol Hill, collecting your tax dollars, right? And they're doing the bare minimum, and they call you lazy. So no, the problem is not that there isn't any money. That's not the problem. The problem is who they think deserves to have it. And it damn sure ain't you. Not unless we flip this whole system on its greedy, hypocritical head. Because I'm tired. I am tired of seeing hardworking people suffer. I'm sick of it. While these clowns in suits collect paychecks for doing nothing. They got money for bombs. They got money for banks. But they don't have money for your health. Miss me with that lie, man.
So first up, the healthcare disaster. So Trump base, which consisted of rural folks, the working class families, they swallowed the lie that Medicaid and social program were socialism. But look what happened. Trump slashing Medicaid, pushing cruel work requirements, and rural hospitals are shutting down left, right. So in places like California, at the 22nd district, a Maga stronghold, families are drowning in medical debt. Here, the nursing homes are closing down, the chronic illness are being untreatable, and the premiums, they are skyrocketing. And here is the gag. These are the same people who cheered when Trump tried to kill the Affordable Care Act. Now big pharma and billionaires are laughing all the way from the bank or to the bank, while Trump voters are realizing they got played. So one viral Reddit post summed it up. This was the greatest mistake of my life. Yikes, that is FAFO for you. So progressives called this years ago. Maga was always a scam. Stir up resentment, get poor folks to vote against their own interests, then hand the keys to the ultra-rich. And now, CNN and New York Times, they have reported the fallout. Federal overreach, disappearing voters gain, and base starting to fracture. This is a classy warfare in red hat and the regret in real life. So you've seen all the polls, we've seen Trump approval rating. They are declining over the years, especially people from rural areas. And why? Because you know what? They fell for Trump's what? Trump's trickeries. And Trump himself, have you seen Trump himself lately? He's falling apart very fast. Even Alex Jones is sounding the alarm, calling it a crisis headed for collapse. Behind the scenes, whisper of heart failure, kidney issues, and Trump being pooped up like Weekend at Venice. The cult leader looks shanky, and Maga is freaking out very bad. You have seen videos, you've seen pictures of him actually, bruises all over. You've seen when he could not walk straight. Where? In the red carpet. So this is not a gossip. It's the collapse of a personality cult. Their healthcare is going. Their leaders is fading, and the GOP is cracking like a cheap glass with midterms around the corner. And that's why they are trying to gerrymander districts to actually increase their position. The voter number is shifting, coalitions are breaking, and Maga is not winning. They're unraveling, they are collapsing. On the left, this was predictable. Trump comeback, a civil society failure, helped by the Democrats dropping the ball, and media personalized or normalized extremism. But here's the spark. The meltdown could actually touch the GOP's grip. If Democrats push hard, universal health care, economic justice, they could flip delusional voters. The question is, will Maga wake up or just sink deeper into denial? So the MAGA people have the choice, because if Democrats want to win this MAGA back to this, because if they are gerrymandering the positions and these guys decide to actually give MAGA what they want, they could win them back. They could win them from this over. How many MAGAs are that just there hanging? Because I've not seen Democrats who are regretting their votes. It's who are the MAGAs who are actually, regretting their votes. So, Dems, this is your chance to actually shine. So, this isn't just an old, or this is just not an I told you so. It's a wake-up call. MAGA voters are learning what happens when you back an ideology that screws the working class. We've got to rebuild with policies for everyone, not just billionaires. So tell me, are MAGA voters finally seeing the light, or is just an act? One more chaos? Drop your thoughts in the comments. Let's get loud about it.
What up, Nurse Gang? What up, TikTok? So I just posted the story of Michael Sheridan, a 35-year-old man down there who unalived himself in a Georgia ER. This man was traveling from New York to Florida to visit with family, had a history of bipolar. He felt the suicidal ideation, and he felt that he was going to unalive himself. He did everything right. He called 911, said, I'm feeling suicidal. They sent him to the ER, but due to a nursing shortage that day, DPOD, which holds psych emergencies, was closed. He was placed in a regular ER and was seen going into the bathroom with several Johnny coats. No one stopped him. He was in there for 30 minutes. He hung up. He killed himself. Since I started this platform, I have been screaming that to the public, stand behind nurses. Everything we are telling you these CEOs are doing, they're doing. Everything we're telling you these big corporations are doing, they're doing. And it's going to affect your health. No one listens. No one stands with nurses when we're marching to the Capitol, or we're doing this or we're doing that. And we're fighting for your safety, your health care. And guess who's being sued? The nurse practitioner, the nurses. Yeah, that's who's being sued. That's who's named in the lawsuit. When the nurses have no control over staffing. Okay? But it's going to fall on you as nurses. Your documentation is going to save you. If you're going to work somewhere that you know is unsafe and that's short, you better document patients in line of sight ordered by such and such. DPOD is closed due to short. Put that in your notes. And if they come back to you and say, why was this in your notes? Because I need to protect myself today. The nurses probably were overworked, overburdened if there was a shortage, and had no one to watch them. Line of sight is not good enough for somebody in an ER who's suicidal. They need to be one-to-one. But we all know how it is as nurses. We'll say this stuff. This person needs to be one-to-one. Something's going to happen. And administration won't care. And guess who's not named in the lawsuit? Hospital admin. They need to start being held accountable. This is why, them proposing that administrators, CEOs need to hold licenses to be ahead of these organizations. They need to be held accountable because the nurses are probably going to be disciplined. If you have a suicidal patient, put all precautions in place because that's an easy way to get jammed up. You have to save them from themselves. What are your thoughts? Let's talk about it.